I saw an 18-year-old man. He came into my clinic as a walk-in patient. I'd never seen him previously. He gave me a history of having been assaulted and was seeking some treatment for pain. On examination, he had blunt force trauma wounds and defensive wounds consistent with his history. He had also a laceration to his scalp, which had been repaired by metal sutures, which he told me had been to the emergency room previously, and they had not adequately treated him for his pain. I agreed to provide him a prescription for some pain medication. And then kind of in passing, he also mentioned that he was under the care of a local psychiatrist. He had some psychiatric problems and was requesting a refill of his Xanax, which he was not able to get from his psychiatrist in a prompt manner. So I agreed to provide him a gap prescription for his Xanax until he could follow up with a psychiatrist. It was a day or two later when I heard on the news that the patient had died of an overdose.
The parents contended Dr. Johnson committed malpractice by prescribing a combination of hydrocodone and Xanax to their 18-year-old son, whom he had seen for the first time on the day that these prescriptions were written. The patient went home and took the medication, took a fatal dose of each medication. And that is, if he had taken only the Xanax, it would have been fatal, and if he had taken only the hydrocodone, it would be fatal. And the parents of the young man believed that the doctor had committed malpractice by that combination of medications, and Dr. Johnson believed that the patient needed to be responsible for the way in which he took the medications himself.
This case has got to be one of the most unusual cases that we have had in our office. The media was heavily involved in this case from the date it happened until the lawsuit was filed and following. The doctor, defense counsel, and myself as a claims specialist worked as a team, as a unit. We continually evaluated the case. We continually reviewed the case as we received expert reports, as we went through the depositions. So the case is not static, but changes as the discovery progresses.
When I first learned of the suit, I certainly felt some emotional response. I think the first thing that happened to me is I just kind of reviewed the encounter in my mind and wondering what I did wrong. I found myself having trouble practicing medicine the same way I always do, getting up and looking forward to going to work in the morning and enjoying seeing patients and communicating with people.
Dr. Johnson was fully exonerated. The jury agreed with us that standards of care had been met and that the doctor was not responsible for the death of the young patient.
I'm very happy with the Doctors' Company. I think that they were very supportive through this whole ordeal. They didn't want me to do anything that I didn't want to do. Certainly I was prepared to defend myself and to take this all the way to a jury and explain the reasons for doing what I did, and they never tried to make me feel differently. Now that it's all behind me, I feel happy about practicing medicine again, and it's good to have them in my corner.